Now?
3, 2. Okay.
Hi, welcome to the KRON 4 Web Chats. I'm Janelle Marie, and you may recognize the gentleman sitting to my left, Dr. Stanley Jacobs. He has been on the KRON 4 airwaves for a while, and so you may recognize him. He is from the Jacobs Center for Cosmetic Surgery. You are the founder of the Jacobs Center for Cosmetic Surgery, mainly in Healdsburg. So welcome to our Web Chats.
Thank you.
We've got the beautiful view behind us.
I know, it's awesome.
It's awesome.
Very happy to be here, very glad.
Yeah.
It's really exciting. It's our first Web Chat, so.
Yes.
And, you know, we do have an office in Union Square, but
Yes.
which is our satellite office, and it's great. We can see patients, but we are located in Healdsburg, and yes, we're not destroyed. The fire didn't touch anything in Healdsburg,
That's
the town.
good to know.
So business is still going on, so
That's
everybody
good.
come up to Healdsburg, to the wineries and
Yes.
restaurants and our facility. I mean, I took this picture yesterday of our facility, so, you know, it's still
So it's all
standing.
there. That's
You
good.
know, it's still great.
Well, I want to mention also before that we are starting a little bit early. So we've got lots going on. We got Dr. Stanley Jacobs, and he's going to be talking about facial cosmetic surgery. So I want to talk to the Facebook viewers right now and let them know if they have any facial cosmetic surgery questions for you, to give them to us now, because we need your questions. This web chat is about the people behind the camera and questions for you. I've got questions here. We're going to talk, but we need those questions from the Facebook viewers also. So bring those questions right now, because we're going to be here for a while. You have 2 patients that are going to come in we're going to talk to. So this is going to be exciting. But let's talk a little bit about your background, a little bit about yourself, about your background, and, you know, just refresh the viewers.
Oh, first thing, I'm a big Sharks fan.
Oh, well, there you
Sharks.
go.
I had to get that
And we're done.
Yes.
Thank you.
Yeah, we're out of here.
We're gone. And they're doing well right now.
They're
so
doing
you're
great,
happy.
4 in a row, yeah.
Well, you're Canadian, so you're a big hockey guy,
I'm a big
right?
hockey guy. I still play in Santa Rosa, yeah. So the facial, the Center Facial, or the Center for Cosmetic Surgery, I'm a facial plastic surgeon, and I did my fellowship at UCSF years ago. So we have a strong connection to the Bay for sure, and that's why the Union Square office. But, Dr. Culbert's part of our team, and he's the breast and body surgeon, and he will hopefully come on a little later.
Dr. Eric Culbertson.
Eric
He's on the website.
And we have 2 patients who are awesome today. They're coming on. They're so graciously said they were going to volunteer to come on.
We get the real before and afters from Trish and Jennifer.
Yep.
So that'll be very exciting.
That'll be very cool to see that. And I've got, you know, everybody wants to see before and afters. I've got a stack of those.
Oh, and your website is thejacobscenter.com. So if you want to see before and afters, if you missed any part of this,
we have a ton of them.
Yeah, go to
There's a gallery.
kron4.com or thejacobscenter.com. We've got all kinds.
Yeah, you hit the gallery and you'll see a whole batch of pictures.
A bunch of them, absolutely.
Yeah, so because obviously that's important. People
It's
want to see
hugely
that.
important. People want to see that.
Want to see that, and so the idea today was to really ask people. You know, you call in, like you said.
Yep.
Get your questions. Sort of everything you want about plastic surgery for you to ask.
Yep.
You know, kind of thing.
We've got him right here.
And
so please ask those questions. Anything.
And we're happy to do that from anywhere from Botox, fillers, cool
That's
sculpting, hair transplants, facial surgery. We're going to talk about
hair transplants. That's huge.
And breast augmentation, whatever. So we're here to kind of talk about that. And the first thing I want to let people know is that, you know, it's very important that, yes, I'm triple board certified, and Dr. Culbertson is board certified plastic surgeon and fellowship trained, but is that we really want to care for patients. We want them to feel comfortable. We talked about this earlier off camera about, you know, really caring for people and making sure that they understand that, because I've been doing this for 30 years, and I've operated on probably 15,000 people and procedures, and it's important for them to know it's not just about doing the surgery, it's about taking care of people.
Absolutely.
Because the doctor-patient relationship is the bond that holds us together. It's what really makes it a special kind of a unique situation, right? I think that term doctor-patient relationship is sort of thrown around, but it really, we have to take it very seriously, that bond. And the whole Hippocratic Oath thing, which is, I still have that document in my wall. Oh yeah, it's fading a bit. But so, you know, that's really important, the experience of the patient. Yeah. We're going to talk a little bit about procedures and get into actual experience, but we're also going to maybe also mention that obviously the outcome's important. So what's our philosophy? Because I think it's important for people to understand philosophy, and therefore, you know, how we think about plastic surgery.
Right.
I think about it, and Dr. Culbertson, in a very natural way. how can we make people look as natural as possible?
Look like themselves.
Look like themselves,
Absolutely.
but better.
Yes.
Because, you know, I really believe every face has beauty in it. Every face is attractiveness if you're a guy or woman. And our job is really to bring out that attractiveness. It's not to detract from that. So part of our job is not to say, okay, I don't like this, I don't like that. The patient says, you know, we get that.
Right.
But what is so lovely that we can kind of make that part stand out.
Exactly.
When I do, say, a rhinoplasty, patients look at them and go, oh, your lips look better, your eyes look better. Didn't touch them. But it's because it fits together.
And it wasn't so, you know,
it wasn't so obvious.
Oh, you had your nose done.
Right. And so that kind of thing is very critical to us, but it doesn't happen easily. It's a lot easier to do something that looks obvious than something that looks very beautiful and subtle.
Exactly.
So, you know, I've been fortunate. I studied actually art and aesthetics all my life.
Wait, I've got a quote from you. Beauty of the fine arts can be applied to aesthetics of facial plastic surgery. That was from you. Yes. And that's what you're kind of talking about, right?
Yes,
how it's not just lifting a face,
right.
It's actually the art of it, and that's what you specialize in.
Right, and and I believe that. I really, you know, I've studied human faces and art for, well, most of my life, and our job is then to say, instead of saying there's a procedure called a facelift or a rhinoplasty or whatever lift or something, is say, instead of that, say what does this person want, what do they need, what makes sense for them, explain the options, and then say how can we use procedures that we have to work for them.
Yes.
Not just ka-jung, ka-jung, you know?
Exactly, not just boom.
No,
lift,
not as cookie
pull,
cutter.
No.
So then it's our job as surgeons, right, to then create and modify our techniques, our basic techniques. It's like saying, here's a palette of paint, and you can paint whatever. If you're a great artist, you're going to take that and paint some really amazing things, right? Not just, okay, I'm just going to paint. So the idea is the same idea.
Yes.
Is how do we make it so that it really looks beautiful and natural. So on our website, we've got lots of things.
thejacobcenter.com.
About, like, for instance, I have a technique called my vector lift or serial vector facelift. There's artist drawings about where the stitches are, what's actually happening under the skin to lift, the, say, the fascia, which is the connective tissue, rather than just pulling skin tight. So we have to have the techniques to match that. And that takes some time.
And it's different with every person, and that's why you're special, because you take every person, not just, oh, another facelift, boom, done. Right. I mean, you have to take their bone structure into consideration and everything, right? Because it's different on every patient. So you have to have that artist's eye to know, if I do it that way that I did it the last patient's way, it's not going to work.
That's right. And that's the other thing about, you know, really studying patients year after year, month after month after year, because if you do that carefully and look at, because what I do is I'll look at the before and afters later, and I'll go, you know, could I have done that a little bit better? What could I have done to tweak that a little bit better? And if you do that for every case, after hundreds and hundreds of cases over years, you're going to get, you know, you're going to get really good. And so basically, like any surgeon, right, we should be, what we're doing today is built upon all those cases you did beforehand.
Exactly.
And that experience to use that. So we shouldn't forget what we've done, obviously.
No,
we want to build on
it.
And that's really important too.
And now we're starting to get questions, but this question is a good one, but I want to wait because we want to talk about first just the facelift first, because the question I'm getting is, what is the downtime for mini facelifts? We're going to get into that because that's kind of the new techniques coming around, but
next.
Let's just kind of talk about the old school facelift, you know, so downtime for that and stuff. Are you still doing a lot of those? Is it more the new techniques? Let's talk about the old school and get that out of the way.
So, you know, it's not really old school. I would say it's just, again, for each person. So some patients who have, you know, a lot of loose skin, a lot of loose fascia, maybe extra fat, maybe their brows are low. There's a number of things going on.
Right.
And it's not just they have a little sagging of the cheek or just a little neck looseness.
Right.
So then you have to do more surgery, right? Again, so in that case, maybe they need an eyelid lift or a brow lift plus a facelift. And so just to kind of give people a sense of facelifts, the incision where you make the cut, right, goes around the sideburn to preserve your hair so it doesn't change.
Yeah.
And you won't see that. And then it goes around this thing called the tragus, which is this little piece of cartilage, so it's not in front. And then behind you into the hair. So even if you have no hair like me or very little hair, once it heals, you can't see it.
Can't see the scar at all.
You want to make it, I call it like the California coast.
Yeah.
Irregularly irregular. You know
Half Moon Bay.
Yeah, you don't want a straight line. There's no straight lines in nature, so there shouldn't be straight lines when we do surgery. So that whole sort of serpiginous, you know, curve to follow the curves of an ear and the hairline, make it look natural. Now, why do we do that? We do that because we want to use that as access to get to the underneath layer.
Okay.
So there's skin, fat, fascia, the key one, then muscle and bone. And patients are sort of dumbed down a lot of times to the doctors and say, we're going to tighten your muscle. We're not tightening the muscle because we did your muscles, you'd be like, it would
That
look
would
right.
be, yeah.
That's bad. But they don't think they understand the word fascia. Well, they do. People are smart. If they can, kids can understand Dumbledore, Harry Potter, they can understand fascia.
Harry Potter fan also.
Well, I'm just saying, why?
Hockey, Harry Potter.
I got kids, I
That's
used to read to them. But it's important that people understand the reality and if you explain it to people, because fascia has good tensile strength, meaning it's strong. Skin is pore strength. So if you just pull a face, use the skin only,
it's not going to work.
It's going to sort of break down and slacken. But if you pull fascia, baby, that's strong.
That's
it's going to lift. And so what we do is we access the fascia by those incisions to get to certain points. Obviously, the jowl is the loosest part of the face. So that's where I actually start sewing from here and working my way back up. So with underneath little tiny stitches to put the fascia back where it came from.
I like that.
That's the key.
Yes.
Put it back where it came from. Thank you very much.
Anywhere else.
And then you don't have to pull the skin tight, because if you don't do enough fascia lifting, then you're like, maybe I should pull the skin tighter. That's when the trouble happens. So we don't want that look. We want to create a natural look, but that's how we do it.
That's just the normal facelift.
That's a facelift with underlying
the real one,
work
the big
on the
one.
neck.
And what's your downtime for just a big
2
facelift?
weeks.
2 weeks. That's good. And you put the drains in, so people after...
No drains.
No drains.
No, I put in drains only in men, and I'd say 1 in 10 men. That's
really?
It. No females.
That's fantastic.
No, so look, this is part of the whole thing about surgery. This is a general kind of comment.
Okay.
Because I did training in cardiovascular thoracic surgery and bypass and everything before I went into this, and I'll just tell you, generally speaking about surgery, it's about being delicate.
Yeah.
And Dr. Culberson will echo this because, and I've watched him operate, we're operating together, but I've watched thousands of doctors, obviously, is that you have to be delicate. You have to be respectful for the tissue. If you're respectful for tissues, it's going to heal really great. If you're getting in and you mess around, there's going to be more bleeding, more problems, more complications.
I like that.
You don't want that. You want to kind of get in, it's like stealth, and get out as though it didn't even know you're in there.
I like that.
It makes a huge difference.
It does.
Cells, I even did, when I did a master's degree in research, I worked in a lab with cells. If you shake them a bit, they won't survive. That's a cell, never mind a human body. So that tells you that we need to be very delicate. So, because people say, well, gee, my friend had surgery and she was bruised for, I don't know, 3-4 weeks or something. I said, how come yours doesn't? Well, you got to be gentle.
And does the patient for a facelift have to prepare a different way?
Well, yeah, I mean, for all our surgeries,
for the big facelift, I mean,
any surgical procedure, or even honestly for some of the injections, you need to not be in a blood thinner 2 weeks ahead.
Okay.
No aspirin, no ibuprofen,
no Motrin,
no fish oil. So those are blood thinners. So if you don't do that, then the chance of bruising is going to be less. After surgery is important, so you take it easy, head elevated, ice a lot. Those are the key things.
And we have a question here on Facebook. How long is the surgery?
So
this is for the main facelift we're talking about right now.
That's about 2 hours.
2 hours for the main. And they're talking about general or local. I know we're going to talk about that, but for the big facelift, what is it, general or local?
General. Okay. Yeah, you can't do it on a local. You need sedation or an actual general anesthetic, but works out to about the same thing. And just quickly, here's a picture of our surgical
center that's
in
right.
Healdsburg.
That's right.
This is the reception, but the bottom's the operating room, and it's a AAAC accredited facility, meaning that it's like the same accreditation as hospitals will have. We have JACO. So it's very safe, so you can have an anesthetic. The recovery is about 45 minutes to an hour, and then if you're living in San Francisco and you have surgery in Healdsburg, we put you up in a hotel.
Oh, okay.
We cover the cost. You stay in a really lovely hotel down the street. You then come back the next day for a dressing change, and then you go home.
And the nice part about the surgery center is it is less expensive than a hospital.
Yeah, by about 1/10.
Your team is so great that, I mean, you just have Dr. Jacobs' team around you.
Yes.
So you don't have to worry about hospital staff or anything like
that.
It's a lovely team.
It's like having the A team every day.
It's like having the A team every day. It's
we
like having the best hockey team around you every day.
Thank God. No, it's true, because that's the thing. I mean, I was chief of surgery at Memorial Hospital in Santa Rosa, and I, at Sutter and stuff. So I know what it's like to work in a hospital setting. Obviously, if I did it for years. But what's great about this is, even if I had a lot of pull, I couldn't always get the people I wanted because they had shifts.
Exactly.
But I can get everybody I want every single day. And knowing them and knowing each other and having that team of my anesthetist, 15 years, my scrub nurse, we're joking that the three of us have like 75 years of experience between us. But it's the experience, but also there's an interchange.
Yes.
See, I want to make sure all our staff, we always tell them, look, I want to hear your opinion. You count. You're part of this team.
Absolutely.
It's not one of these top-down things at all. It's all like level playing field.